Hi, my name is Jessica Hundley, and I'm presenting for my Leadership and Management ADN to BSN nursing class on creating a healthy work environment. So at my current place of employment, our situation is the providers would like for the nurses to sit in the room with them during the complete nursing or patient visit from start to finish. And while the nursing staff is in there, they would like for the nurses to input follow-up visits, imaging orders, lab orders, medications, and send them over electronically. They would like us to input pathology and then fill out a form for photography to come in, call photography, set up for biopsies, and then bandage the patient and kind of take those specimens where they need to be sent off. The nursing staff is pretty upset about having to do the doctor's work, is what they say. So they're not willing to comply with that request. And the other thing, the nurses staff, there was a point in time where we were short staffed due to maternity leaves, people that quit. And so the nursing staff needed to be cross-trained in all of the specialty areas within our department, which would include the cosmetic center, the patch testing, the light room, the procedure clinic, our Mohs surgery center, in addition to just your regular clinic hallway. And there are several complaints from the nursing staff that they have preferred areas they'd like to work in, and they don't really like to have to switch where their assignment is. So one of the things that we have suggested is for the nursing staff to kind of fill in their own template of where they prefer to work for the month. So they'll do that a month ahead of time. And that kind of gives them some control over their work environment and hopefully will make for just a happier work environment overall. So in conflict management, in the scenario that we discussed previously, several of the conflict management strategies were utilized, and that includes competing when one gets their way versus both compromising. So the nursing staff is kind of getting their way with regards to where they want to work each day, and the physician request has been kind of put on the back burner so that we can increase the morale of the nursing staff overall. In addition, accommodating, so kind of, the providers are sacrificing what they want in this point in time for the nursing staff to kind of get a win under their belt. Smoothing, which again, one party is sacrificing for the other or lets the other, pacifies or soothes the other party. And then collaborating, so the nurse management is collaborating with the nursing staff to try to just make things happier overall. And these conflict management strategies are according to Marquise and Houston 2017. So in a situation of negotiation, there are some factors to consider before, during, and then after the negotiation period. In order to have a productive negotiating meeting, some steps should be considered before. Make sure you do your homework. So be well informed of what the situation is and have an alternate option. Know what you're willing to concede on and then what you want to push for. And then consider future trade-offs or gains out of this negotiation. During the negotiation, you want to make sure you're calm, you're cool, you're collected. Being prepared with the material helps you to be calm and collected. Make sure you learn about the people that you're negotiating with, and the other person will tell you everything you need to know if you're just sure to listen to them. And then last, after the negotiation, you want to make sure that you restate what you guys have agreed on so that everyone's clear and on the same page. And then you want to make sure each side kind of feels like they had a win out of the situation as well. Some destructive negotiation techniques include ridiculing. And if that were to happen, if somebody kind of attempts to intimidate the group, make sure you remain relaxed. Keep your body position in a relaxed state, steady gaze, and just a patient smile. And focus on solving the problem. Another destructive negotiation technique is an ambiguous question or inappropriate question. Sometimes a person of authority, if you're under them, you feel the need to answer their questions regardless if it's on topic or not. So just making sure to redirect the conversation back to the issue that's at hand. And last, sadness is another destructive negotiation technique. When you're addressing someone that's sad, you tend to concede, and the negotiator foregoes their gain as a result of feeling a concern for the other individual. That's according to Marquise and Huston, 2017. With regards to delegation at my current facility, I work in dermatology, and there are times we have upwards of 50 biopsies a day, and you can imagine how busy our nursing staff is just in clinic itself. So to make sure to break away at appropriate times throughout the day and send specimens off. We were having issues where the lab was calling saying they were getting them all in the afternoon, they weren't getting them throughout the day. So we just made sure to delegate a team member each day to send specimens off at designated times, being 10 a.m., 12 p.m., 2 p.m., and 4 p.m. And with someone being assigned to that task, it gives accountability for that person. If it's not being done, you know who to go to find out, what's the problem? Is there anything that I can help with? And the daily assignment is posted on the whiteboard as well, so they know where to look to know who's responsible for that day. The 5 rights of delegating: right task, right circumstance, right person, right direction or communication, and right level of supervision. When a new employee begins on the unit, there's a specific checkoff for sending specimens in the proper way that we do that at our facility. And it's a 2-person checkoff. So the person that is collecting the biopsy does the initial sign off that it's the right patient, right site, right time. And then the person that is sending the biopsy is their double check. So they're going to make sure the patient names match with the requisition and the bottle, and the sites match, and then send it to the lab. There's a clear, concise written checkoff procedure for them to do this. During their training, they're shown how to do it, and then they teach back and they do it themselves. And then there's always, feedback that's given immediately if they're not following the proper protocol. And there's always a team lead available in the clinic, because sometimes, it's just a backlog of patients and we're there to help them. Strategies for successful delegation. Several of these strategies were applicable to the previously described scenario. The necessary skills and education level were identified. You want to make sure you empower your staff to know that they're capable of performing the task, and clear goals are communicated. So we want these timeframes met each day. Some strategies that could be more refined is just planning ahead better, because at that point in time, we're doing this as a daily, the morning of, asking for a volunteer, whomever's in clinic that day, to be responsible. And also rewarding accomplishments. So just being able to identify that this process is being followed, and then, recognizing people for their efforts. It was a fairly new process. And, just want to make sure that we're recognizing their hard work. And this is according to Marquise and Huston, 2017. Some delegation errors include under-delegating, over-delegating, or improper delegating. So make sure that you're assigning appropriate tasks to appropriate personnel, and then have confidence in their ability to complete the task. Try not to burden your subordinates by over-delegating because of your own poor time management or your insecurity in the ability to perform the task. And then make sure to give your staff proper information so that they can perform the task and they know what's being expected of them. An experience that I've witnessed in the past is when a co-team lead would just perform the specimen sending, on their own administration time, and them not recognizing the importance of their admin time and several other things that they need to get finished within that amount of time, rather than delegating that to someone that could handle that task. So, healthy work environment. According to the World Health Organization, they define a healthy workplace as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. That's according to World Health Organization 2010. And my present work environment can be negative, and that can be draining to the staff that's surrounding. So it's important to actively listen to what your employees' complaints are, and then show action for improving those complaints. And this particular series has been really helpful in laying out some guidelines for successful negotiating among my team members. So I look forward to being able to use that in the future. And please see the following references that were used during my presentation. Thank you.